video of mine is about hepatitis C, which is a viral infection that causes liver inflammation, sometimes leading to serious liver damage. The hepatitis C virus spreads through contaminated blood. Until recently, hepatitis C treatment required weekly injections and oral medications that many HCV-infected people couldn't take because of other health problems or unacceptable side effects. That is changing today. Chronic hepatitis C virus is usually curable with oral medications taken every day for 2 to 6 months. Earlier, I posted a short video about hepatitis C virus on this channel. I hope you have already seen that video, and today I am going to discuss this illness in detail. Well, still about half of people with HCV do not know they are infected, mainly because they have no symptoms, which can take decades to appear. For that reason, the US Preventive Services Task Force recommends that all adults aged 18 to 79 years be screened for hepatitis C, even those without symptoms or known liver disease. The largest group at risk includes everyone born between 1945 and 1965, a population 5 times more likely to be infected than those born in other years. Now I'll tell you the symptoms. Long-term infection with the hepatitis C virus is known as chronic hepatitis C. Chronic hepatitis C is usually a silent infection for many years until the virus damages the liver enough to cause the signs and symptoms of liver disease. Signs and symptoms include bleeding easily, bruising easily, fatigue, poor appetite, yellow discoloration of the skin and eyes, which is known as jaundice, dark colored urine, itchy skin, fluid buildup in your abdomen, that is known as ascites, swelling in your legs, weight loss, confusion, drowsiness, and slurred speech. That is because of a complication of hepatitis C, which is hepatic encephalopathy. Then you may suffer from spider-like blood vessels on your skin, which are known as spider angiomas. Every chronic hepatitis C infection starts with an acute phase. Acute hepatitis C usually goes undiagnosed because it rarely causes symptoms. When signs and symptoms are present, they may include jaundice along with fatigue, nausea, fever, and muscle aches. Acute symptoms appear 1 to 3 months after exposure to the virus and last 2 weeks to 3 months. Acute hepatitis C virus infection does not always become chronic. Some people clear HCV from their bodies after the acute phase, an outcome known as spontaneous viral clearance. In studies of people diagnosed with acute hepatitis C virus, rates of spontaneous viral clearance have varied from 15 to 25%. Acute hepatitis C also responds well to antiviral therapy. Now I'll tell you the causes. Hepatitis C infection is caused by the hepatitis C virus. The infection spreads when blood contaminated with the virus enters the bloodstream of an uninfected person. Globally, HCV exists in several distinct forms known as genotypes. Several distinct HCV genotypes and more than 67 subtypes have been identified. The most common HCV genotype in the United States is type 1. Although chronic hepatitis C follows a similar course regardless of the genotype of the infecting virus, treatment recommendations vary depending on viral genotype. Now I'll tell you the risk factors. Your risk of hepatitis C infection is increased if you are a healthcare worker who has been exposed to infected blood, which may happen if an infected needle pierces your skin, or if you have ever injected or inhaled illicit drugs, have HIV, received a piercing or tattoo in an unclean environment using unsterile equipment, received a blood transfusion or organ transplant before 1992, received clotting factor concentrates before 1987, received hemodialysis treatment for a long period of time, were born to a woman with a hepatitis C infection, were ever in prison, were born between 1945 and 1965, the age group with the highest incidence of hepatitis C infection. So these were the risk factors. Now I will tell you the complications. Hepatitis C infection that continues over many years can cause significant complications such as scarring of the liver, which is known as cirrhosis. After decades of hepatitis C infection, cirrhosis may occur. Scarring in your liver makes it difficult for your liver to function. Liver cancer. A small number of people with hepatitis C infection may develop liver cancer. Liver failure. Advanced cirrhosis may cause your liver to stop functioning. Now I'll tell you the preventive measures. Protect yourself from hepatitis C infection by taking the precautions which I should tell you now. You should stop using illicit drugs, particularly if you inject them. If you use illicit drugs, seek help. Be cautious about body piercing and tattooing. If you choose to undergo piercing or tattooing, look for a reputable shop. Ask questions beforehand about how the equipment is clean. Make sure the employees use sterile needles. If employees won't answer your question, look for another shop. Practice safer sex. Do not engage in unprotected sex with multiple partners or with any partner whose health status is uncertain. Sexual transmission between monogamous couples may occur, but the risk is low. Now I will tell you about the diagnosis of hepatitis C. First of all, I should throw some light on screening for hepatitis C. The U.S. Preventive Services Task Force recommends that all adults aged 18 to 79 years be screened for hepatitis C. Even those without symptoms or known liver disease. Screening for HCV is especially important if you are at high risk of exposure. That include anyone who has ever injected or inhaled illicit drugs, anyone who has abnormal liver function tests results with no identified cause, babies born to mothers with hepatitis C, healthcare and emergency workers who have been exposed to blood or accidental needle sticks, people with hemophilia who are treated with the clotting factor before 1987, people who have undergone long-term hemodialysis treatments, people who received blood transfusion or organ transplant before 1992, sexual partners of anyone diagnosed with hepatitis C infection, people with HIV infection, anyone born from 1945 to 1965, anyone who has been in prison. Other blood tests. If an initial blood test shows that you have hepatitis C, additional blood tests will measure the quantity of hepatitis C virus in your blood, that is known as viral load, and identify the genotype of the virus. There are some tests for the liver damage. Doctors typically use some tests to assess liver damage in chronic hepatitis C. These may include magnetic resonance elastography, which is a non-invasive alternative to liver biopsy. This magnetic resonance elastography combines magnetic resonance imaging technology with patterns formed by sound wave bouncing of the liver to create a visual map showing gradients of stiffness throughout the liver. Stiff liver tissue indicates the presence of scarring of the liver, that is fibrosis, as a result of chronic hepatitis C. Other similar test is transient elastography. Then one can also call liver biopsy, which is typically done using ultrasound guidance. This test includes inserting a thin needle through the abdominal wall to remove a small sample of liver tissue for lab testing. Blood tests. A series of blood tests can indicate the extent of fibrosis in your liver. Now I'll tell you the treatment. Antiviral medication. Hepatitis C infection is treated with antiviral medication intended to clear the virus from your body. The goal of treatment is to have no hepatitis C virus detected in your body at least 12 weeks after you complete treatment. Researchers have recently made significant advances in treatment for hepatitis C using new direct-acting antiviral medications, sometimes in combination with the existing ones. As a result, people experience better outcomes, fewer side effects, and shorter treatment times, some as short as 8 weeks. The choice of medication and length of treatment depends on the hepatitis C genotype, presence of existing liver damage, other medical condition, and prior treatment. And due to the pace of research, recommendations for medication and treatment regimes are changing rapidly. It is therefore best to discuss your treatment option with the specialist. Throughout treatment, your care team will monitor your response to medication. Regarding the name of the medicine, you can see on the images which I am posting in this video, because my video is not only important from listening point of view. You should see all the relative images when I talk about a particular illness. Okay. Also, in some cases, we may need liver transplantation. If you have developed serious complication from chronic hepatitis C infection, liver transplantation may be an option. And during liver transplantation, the surgeon removes your damaged liver and replaces it with a healthy liver. Most transplanted livers come from deceased owners, though a small number come from living donors who donate a portion of their livers. In most cases, a liver transplant alone does not cure hepatitis C. The infection is likely to return, requiring treatment with antiviral medication to prevent damage to the transplanted liver. Several studies have demonstrated that new direct-acting antiviral medications regimens are effective at curing post-transplant hepatitis C. At the same time, treatment with direct-acting antivirals can be achieved in appropriately selected patients before liver transplantations. Vaccinations. Although there is no vaccine for hepatitis C virus, your doctor will likely recommend that you receive vaccine against hepatitis A and B viruses. Well, on my channel, I have already posted videos about hepatitis A and B. You can see those videos. There are separate viruses that also can cause liver damage and complicate the course of chronic hepatitis C. Now I shall tell you some lifestyle and home remedies. If you receive a diagnosis of hepatitis C, your doctor will likely recommend certain lifestyle changes. These measures will help keep you healthy longer and protect the health of others as well. You should stop drinking alcohol. Alcohol speeds the progression of liver disease. So better you should avoid it completely. You should also avoid medication that may cause liver damage. Review your medication with your doctor, including over-the-counter medication you take as well as herbal preparations and dietary supplements. Your doctor may recommend avoiding certain medications. You should help prevent others from coming in contact with your blood. Cover any wounds you have and do not share razors or toothbrushes. Do not donate blood, body organs or semen, and advise your healthcare workers that you have the virus. Also tell your partner about your infection before you have sex, and always use condom during intercourse. Well, this was my video about hepatitis C virus. If you have any question about this illness, you can post your question in the comment section.